Good morning, everyone. We are here to talk about what is a doula. So today we're going to walk through the consultation and the support that the doula provides. And our previous webinars, they have been recorded and are on our YouTube channel for your pleasure of viewing it and catching up with our series. I'm going to also drop the link in the chat to where you can find it. Give me one moment. Un momento, por favor. And I will drop the link in the chat where you can find our previous recordings and much, much more. All of our classes, we record them and we place them on our YouTube channel. So there you go. Just dropped it in. So my name is Alicia Hurt. I am the executive director here at I See My Baby, the Women's Wellness Center in Bainbridge, Georgia. And I have the pleasure of being a doula and life coach. And we have alongside us Miss Tiffany Austin. She is the head doula and birthing experience support person here. And so let us dive into a little bit of what we provide you here at the Women's Wellness Center. So again, welcome. And just know that choosing a doula is a powerful step in preparing for your birth experience, and that a doula provides emotional, physical, and informational support before, during, and after your labor. And while doctors and midwives focus on medical aspects of childbirth, we, the doulas, we focus on your overall well-being, and we ensure you feel informed, empowered, and supported. So today we're going to discuss what to consider during your doula consultation, because yes, you do need to have a consultation so that you understand if you both meet the needs for one another, right? And you gel well. The importance of developing a strong connection with your doula, and also how to keep communication lines open. Very important. Very important. You got to talk to your doula. You have to tell your doula what's going on. It is imperative because they're the ones that are helping you, walking you through it. I mean, everything. Because we may just say to you, hey, you need to call your doctor, but we still need to know what is going on with our clients. All right, I was trying to make sure I shared it everywhere. I think I did, y'all. If not, y'all, please help me out and share and like. And if you're watching the replay, thank you very much. We're going to talk through steps to prepare for birth, including classes and hospitals / birthing center tours, how doulas can assist with home births, and 3 birth scenarios. We're going to walk through it together and compare experiences that you have a doula or when you don't have a doula, how the experience is different. Okay, so the first thing is the experience and the training. So you want to ask about their certifications. Where were you certified? Some examples would be DONA, International, CAPPA, and ICEA. There are a whole lot of doula programs out there, but you want to know, where'd you get your certification? Were you self-made, self-taught, and then look up those organizations and see how credible they are. Do Google reviews. You'll definitely get the raw truth. And then you want to inquire about their experience with different types of births. Have they done natural, medicated, cesarean, VBAC, which is a vaginal birth after cesarean, or any high-risk births? Just ask them about themselves, their resume. An example would be if you were planning a water birth, you may want a doula that's experienced in hydrotherapy techniques. And remember that your initial meeting with your doula is the opportunity to see, like I said, if it's the right fit. It's like a relationship. You dating, you're trying to figure this thing out. And like I said, and then you can also use your divine, like women, we have intuition. So you can just say, you know what, she may not have that experience, but I just feel like I really like her. Like we really gel well. Like my spirit really feels confident in her. But you still want to ask robust questions and make an informed decision. The other part would be the birth philosophy and approach, because if that doula believes in something that you don't, you know that it may be a pull and tug situation during the birthing process, and you don't want that. You want all of your wishes to be rendered and respected. So does the doula align with your views on birth interventions, pain management, and medical decision making? Some doulas focus on holistic, natural approaches, while others will support natural and medical options. And I'm one that supports both natural and medical options. So if you prefer a hands-on approach with physical touch and massage, ensure that your doula offers those services. So making sure that they're okay. Yes, they'll massage you there, they'll touch you and things of that sort. Those are important questions to ask. You don't want to find out during labor, tell my, oh, my feet, and they're like, I don't do that. Support style and services offered. Some doulas offer prenatal visits, postpartum support, or even lactation consulting, where others, they specialize in different things. So one will be bereavement if there's a loss for any reason, a high-risk pregnancy, or hypnobirthing techniques. I've never done hypnobirthing techniques, but I've heard it's a thing. And the example would be if you need postpartum support, you look for a doula who provides home visits for baby care and guidance and emotional recovery. But you only know that when you ask during the initial consultation. The availability and the backup plan. So here at the center, we back each other up, and then we have other doulas that are in the community that can support us. So you need to know, is it just you? If it is someone else, like how far away are they? Can I meet them? Can I get to know them just in case? So you want to confirm their on-call period and whether you have a backup doula in case of emergencies. So an example would be if your estimated due date is during the holidays, ensure that they're available or have a backup plan ready. Cost and payment plans. So you ask about the fees, the payment plans. Do they accept insurance, health and savings accounts, or Medicaid programs that cover the doula services, which many of us do. And if you need financial flexibility, some doulas offer a sliding scale fees or bartering options, meaning, we can talk it through. We can work together with it. So you want to develop a strong connection with your doula. Again, your doula will be with you during one of the most intimate moments of your life. A strong relationship enhances trust, comfort, and effective support. So here are 4 things to break that down. You want to have regular meetings and prenatal visits. So these meetings allow you to discuss birth preferences, pain relief techniques, and address concerns. And a mother who had a traumatic first birth may need additional emotional preparation for her next delivery. Be honest and open, right? Having that transparent communication, it goes a long way. Helping them understand your fears, your expectations, and your health history. So if you are anxious about labor pain, your doula can introduce guided meditation or breathing techniques that are tailored to you. And they also have hands-on practice with comfort massages. So you can practice labor positions, counter pressure techniques, and relaxation methods together. Here at the center, we do yoga once a week on Mondays. Shout out to Fertile Ground Family Services. They provide it and host it every Monday. And then once a month, we do West African dance, and they teach you techniques in there as well. And if you struggle with lower back pain, your doula can teach your partner hip squeezes and massage techniques that can help, because we're here for you and your support person to show up and show out during that labor process. So your partner involvement and family preparation. So if you have a partner, your doula can help them understand their role, provide guidance on how to support you effectively. And we do that through our class, the support system. We also have Mr. Reeves here that runs the men's support program specifically to help fathers through the fatherhood process and the journey that they go through, also mentorship and coaching. So another example would be a partner may not know how to advocate for your birth plan, but a doula can empower them with knowledge and tools. And that's before the baby, before the birth, and during the birth. So let's keep the lines of communication open. And we keep talking about it because it's critical, it's vital, and it may be new to some people. You may be very private. It's like, okay, this isn't a time to be private because we are working through this literally together. And so you have to have a preferred contact method. So you establish how and when you can reach a doula. Some prefer text updates, while others are available for calls anytime. And I tell my people we can do texting all the time. If it's an emergency, of course, call. And then when we lead up to your birth date, then you got me. You got me. I am ready. I'm at your beck and call. Also, your emergency protocols and early labor updates. So discuss when to call your doula, whether during early labor at home or when you're heading to the hospital. And that's actually a part of our intake documents. We talk through that. An example would be if contractions are irregular but increasing in intensity, your doula can guide you on when to leave for your birth location. Postpartum check-in. So many doulas provide postpartum visits to discuss birth recovery, breastfeeding, and emotional well-being. And we do 2 visits here at I See My Baby. And then if you need more, then we talk through that plan for postpartum support. So an example would be a new mom struggling with latching issues can receive hands-on lactation support. Preparing for birth. So attending the birth classes. So we have 2 ways here at the center. We have the in-person classes and webinars, and then we also provide all of our clients with a course, a 10-module course. So you get it double. Actually, there's a third way is when you come to our yoga classes and also our West African dance, you get support that way as well with your techniques. So what it says here on the slide is the birthing classes. They teach you labor stages. Yes, it does. The pain management and the coping techniques. And you can consider all kinds of things. Lamar's classes, I did that for my first baby. The Bradley method, and also hypnobirthing. You want to do your research and you find what fits you best. Also, touring the hospital or the birth center, because you don't want it to be the first time you enter there is when you're giving birth. You want to feel comfortable. If anyone is similar to me, you get like anxiety, you get like, whoo, okay, where do I go? What do I do? But if you've done the tour, you know what to expect. You know what the NICU looks like, where they'll bathe your child and give your child the first shots and weigh them and all that good stuff. You know what the rooms look like. So when you're coming in, okay, all right, yep, this will look okay. Maybe I need to bring a couple pillows for my support person and things of that sort. You know where things are, and you're not just like rushing to the emergency space when you can just go right to labor and delivery. You know exactly where you are, and it calms you down and it decreases the stress. You learn all of the policies on interventions, again, birthing positions, because different facilities may have different requirements and restrictions, and understand the visitors, because everybody gonna want to come. They want to come see the baby. So you have to understand protocols so no one's feelings will be hurt. So again, here's an example. Some hospitals require continuous fetal monitoring, which may impact the movement during birth. So if they have you strapped in to the monitor to hear the baby, that means you can't walk around like you would like or do certain poses, because then they cannot get the fetal monitoring as they need it. So you need to know that up front. And then with the home birth considerations, so doulas can support with home births based on state laws. So you have to check with your state, and then you have to ensure that your midwife and doula have a coordinated plan and emergency transfer protocol. So I do know right now in the state of Georgia, midwives are not recognized to do home births. However, we can still support you as a doula. All righty, we're rolling right through. So how does a doula's role change in different birth environments? This is a good one. So while the core role of a doula remains the same, providing emotional, physical, and informational support, their approach varies depending on the birth setting. So let me tell you how. So number 1, home birth. So the doulas are a comfort and advocate partner. So home births are often chosen by those seeking a more natural, intervention-free experience. So we work closely with the midwives to ensure a smooth birth experience. We provide hands-on comfort measures such as a massage, counter pressure, and positioning assistance. We help you maintain a calm and sacred space through lighting, aromatherapy, candles, relaxation techniques, whatever we have discussed during your birth plan consultation. We also offer emergency preparedness support, and we ensure that parents understand transfer protocols if a hospital becomes necessary. So what will happen if the midwife is like, no, we need you to go to a hospital? We talk through together how it will go down. So here's a question to ponder on. What are some misconceptions about home births that doulas can help clarify? So here's an answer. So a common misconception is that home births are unsafe. It's not true. In reality, planned home births with trained midwives and doulas can be a safe option for low-risk pregnancies. So doulas help ensure that parents understand their options and they recognize warning signs for medical transfer, and they feel supported throughout the process. Another question would be, how might having a doula at home birth improve safety and emotional well-being? Well, I'll tell you. The doulas provide continuous monitoring of the birthing person's comfort and stress levels, which helps keep labor progressing smoothly. It keeps it running smoothly because you're like, okay, I can see Alicia, she's feeling some kind of way. So let me go ahead and give her some massage and let me coach her along the way. Let me just keep a pulse on how she's feeling emotionally, because that triggers how the birth is going to go, honestly, because that baby feels, your body tenses up and you're not able to do what you're supposed to do, which is when it's time, push. So number 2, birthing centers. So birthing centers, they bridge the gap between home and hospital. Yeah, they do. So a birthing center provides a home-like environment with midwifery care while being close to medical facilities. So the doulas are here. We're here. We can help you with the birthing center birth, and we enhance the personalized low intervention experience by supporting unmedicated birth preferences, meaning you don't want any pain medicine. You want to go through the process naturally. We coordinate with the midwives and the nurses to ensure the birthing person's needs are met. And we also help with labor progression throughout the movement, right? Through the movement, through the hydrotherapy in the birth tubs and the birthing techniques. And I can't wait for my client to come and say they want to have a birthing center experience, because I'm ready. We support informed decision making. We help clients understand potential interventions if needed. So here are 2 more questions to ponder on. So what are the benefits of choosing a birth center over a hospital? So birthing centers, they offer a more intimate and home-like setting, often with fewer medical interventions and greater autonomy for birthing person. So you get to make more decisions. And they also provide immediate postpartum care, which includes breastfeeding assistance while still having emergency transfer options if needed. So if something is escalating and not progressing, and you need to maybe do a cesarean or what have you, or have a medical intervention, then we do the transfer. But the good thing is they take the time at the birthing center, whereas in the hospital, sometimes they don't have enough staff, or after you have the baby, it's like, all right, we'll come and check on you, but there's not an urgency to support with something similar to like a breastfeeding. They may give you the basics, but then, you're on your own until you get a lactation consultant or your doula can help you through it. The second question would be, how can a doula complement midwifery care in a birth center? Well, while the midwives focus on the clinical care, similar to the doctors in the hospital, the doulas provide continuous emotional and physical support. So they stay with the birthing person throughout the labor. They ensuring comfort, guiding breathing, and helping maintain a positive mindset throughout the birthing process. All right, so here's number 3, hospital births. So in hospital births, what we do is advocate within the medical system. So even in hospital settings where their medical interventions are more common, guess what? Doulas can still help you. We're still here to support. So we act as your advocate. What you tell us your preference is, we walk through that with you, and we assure you that, hey, you know, my client would like so-and-so. They may say, this is what's going on. What are your thoughts? And we would have already talked through plan A, B, C, and D. And so then we can just go back down the list. All right, she said that she's fine with that. And you can change your what you feel. You can change it, and I go with it as your doula. But we're there to advocate for you and honor what you would like. We support your natural pain management techniques, even if an epidural is chosen. We help reduce unnecessary interventions such as labor induction and C-sections. And we provide reassurance and clarity when medical staff presents options or recommendations. So let's do a discussion, a brief discussion. So how can a doula help someone navigate hospital protocols? Well, the hospital often has strict procedures, but a doula can remind parents of their rights, explain in medical terminology, and offer alternatives. For example, if an induction is suggested, a doula may help the parent ask about waiting longer or trying natural labor stimulation methods first before we do the cesarean. Does having a doula reduce the chances of a C-section? Yes, it does. Studies have shown that continuous labor support from a doula can lower the likelihood of a C-section by reducing stress, encouraging movement, and promoting effective labor techniques. All right, now we're moving on to number 4, which is a planned cesarean or C-section birth. And we support with emotional and physical support beyond surgery. So for planned C-sections, as a doula, we help with pre-surgery preparation, addressing fears, and ensuring birth preferences are communicated. We also provide emotional reassurance in the operating room, if allowed. And it is. I've met some really good, well, with my times in there, some good anesthesiologists that allow you autonomy or in the recovery. We support with postpartum healing, including breastfeeding, right? The initiation of it, how to hold the baby, how to position yourself, feel comfortable. Also reminding you about that liquid gold, and it's not all about the quantity, but the quality of what you're producing for the baby initially. Assisting you with bonding with the baby, such as facilitating skin-to-skin contact as soon as possible. So let's do a brief discussion. So how can a doula support someone having a planned C-section? So again, we help parents feel emotionally prepared by discussing expectations and providing relaxation techniques. Post-surgery, that we assist you with positioning for breastfeeding, ensuring comfort during recovery, and helping with newborn care when mobility is limited. So do doulas still provide value in the birth as it's surgical, right? Absolutely. Yes, we do. While the medical team focuses on the procedure, the doula focuses on the birthing person's emotions, well-beings. We advocate for your preferences like immediate skin to skin, and we assist with postpartum recovery. And it is the best feeling ever when they put that baby on you. You're like, okay, so we're going to go through some birth scenarios with and without a doula. So the first one is the first-time mom with a long labor. So without a doula, Sarah's labor was for hours. She was exhausted and unsure of her progress. Her partner felt helpless. He didn't know what to do. And the hospital staff, they were busy. She gets an epidural, but later needs a cesarean due to a stalled labor, feeling overwhelmed. So with the doula, guess what happens with Sarah? So the doula helps Sarah. She stays calm at home with breathing techniques and massage. Her partners feel confident in his role. He knows what to do. He went through our classes with Mr. Reed. Okay, and so by the time they reach the hospital, she's coping well and she avoids unnecessary interventions. Yes, sir, yes. So scenario 2, a planned epidural birth. So you already know, we get an epidural. Don't ask me, Jessica's like, we get an epidural. So without a doula, Jessica expects a smooth labor, but she struggles with pain while waiting for the anesthesiologist. And once she gets the epidural, she feels disconnected and unsure about pushing. But Jessica, then she has a doula. Let's think about it. Now she has a doula. So the doula will help Jessica manage her pain before the epidural. Breathing, massages, movement, centering her emotions. And guess what? It keeps her engaged in the process, and she feels more in control and confident when it is time to push. Okay, Jessica? All right. So then number 3, unmedicated birth with a supportive partner. So without a doula, Marcus tries to support his wife. He tried. And Lisa, but struggles under pressure. Lisa, like, Marcus. He's like, I don't know what to do. So she feels overwhelmed and she loses focus, but making labor more difficult. But with the doula coaches Marcus, like, Marcus, let me tell you, rub like this, right? Go ahead and get the ice chips or get the rag, or, and starts to show him how to apply counter pressure and offer reassurance. Baby, you doing good. You doing good. All right, let's breathe. Remember our breathing. And Lisa feels safe. She feels supported and able to stick to her birth plan. We saved Marcus on that one. All right, so scenario 4, emergency cesarean birth. So this is without a doula. So when complications arise, Mia is rushed into surgery. She feels anxious and her partner is unsure how to comfort her. Postpartum, she struggles with emotional recovery. But with the doula now, the doula reassures Mia and she explains everything, every step of the way. She stays by Mia's side and she helps her process emotions and adjust to recovery smoothly. So we are going to conclude today. I am a proud doula. Yes, I am. And I want to give you some final thoughts. A doula provides continuous, personalized support. So it's not a one-size-fits-all. It is based on our clients, and we help you feel empowered. We help you feel informed, and we care for you throughout your birthing journey. So whether you're planning a natural birth, a hospital delivery, or a home birth, having a doula by your side can make a significant difference in your experience. So if you're considering hiring a doula, take the time to find the right one for you. Open communication, strong connection, and throughout preparation can lead to a more positive and fulfilling birth experience. So encouragement, we are encouraging you to explore doula services for a more supported birth experience. So every birth journey is unique. And having a doula really provides you the personalized care you need, the continuous support that's tailored to your specific birthing needs. And whether you're navigating in a hospital protocol, you're preparing for unmedicated birth, a smooth postpartum transition, or a doula that is supporting you with a home birth, listen, we're here to bring knowledge and reassurance to you, and we're here to advocate throughout the process on your behalf. Here is some quick Q&A for you. Here's one question. What does a doula do during labor? We talked through that. We are here to support you through exercise, breathing, movement, helping you with the medical terminology, giving you all the information that you need and resources, helping your support person. How are we different from a midwife? So the midwife is the medical professional. They actually help. They bring the baby forward, they touch you, check you, help you with the cord clamp and all of that. Whereas the doula, we're alongside you, but we do not do the medical care. We do not touch you, the baby during labor and all those things. We are just there to support you. Physical support, emotional support. So can a doula still help if I get an epidural or have a cesarean birth? Again, yes, we can help you. We can help you because we're there to encourage you through the labor. We're there to inform you, to make sure you are emotionally supported during the process and that you recover and help with your early bonding after birth. Will a doula replace my partner's role? Absolutely not. We are there as an enhancement to your team to motivate you, to support your partner, to make sure you all are informed and you do not feel overwhelmed. And how do I choose the right doula? Well, you reach out to us here at the Women's Wellness Center and we can help you with that. Our number is 229-929-3240. We are at 310 South Scott Street in Bainbridge, Georgia, and we are here to support you. We can set up a consultation with you, give you a tour, talk through the process with you. We are here to support you, okay? And again, why choose our doula services? Well, we have personalized care. Our doulas offer continuous one-on-one support during labor and delivery, and we help to reduce stress and enhance comfort. We improve your birth outcomes. Studies have shown that doulas assist births can lead to higher scores for newborns and decrease the likelihood of a C-section. We also help with advocacy and empowerment. Throughout the process, we are keeping you informed. We are empowering you through your decision making, and we are respecting your voice. We're respecting what you said. So again, here at the Wellness Center, we understand that every pregnancy is unique. Our team is dedicated to providing the highest standard of care, ensuring you feel supported, empowered, and confident throughout your journey into motherhood. So we would love for you to choose us for your doula services and beyond. Because of our experience, we make a difference and we have compassionate, personalized care, right? That personal touch to support you. So again, here is our information on the screen. We want you to keep in touch with us. We also have free pregnancy boxes and supplies and things here to support you navigating your journey. My name is Alicia Hurt again. I am just here. I'm here to support you with lactation, postpartum, even with bereavement services. We are here, myself and also Tiffany Austin. So give us a call, get on our schedule, and I hope you guys have a wonderful day. I hope you were able to learn something as well from this presentation. Take care. Love you guys.